Good afternoon, friends. Good afternoon, friends. I'm Dr. Aajay Shah, and we are bringing you another Facebook Live. We have some good news to share. We have crossed 20,000 followers. Good afternoon, friends. We have now crossed 20,000 followers. Matter of fact, 21,000 followers. And that's a big achievement, in my opinion, in just last 6 months. Thanks to Hannah, thanks to my family, thanks to my wife, and thanks to all the great followers who have invited their friends and family to follow our page. So that's one good news. Second thing, we are bringing many live guests on a regular basis. Yesterday, we had a great guest from Jessie Dietz, and she covered extensively about how to be resilient, how to win in every aspect, no matter what the life throws at you. So we have some great Zoom guests, great live guests coming on. We are also doing this cooking demonstrations on a Facebook Live. We'll be possibly doing one late tonight, so please stay tuned for that. So we have some exciting things going on. We have expanded our pillars of healthy lifestyle. Please reach out to our page to see what those pillars are. I'll discuss those pillars on one of the live also. So today I'm going to complete diabetes seminar. I gave the diabetes seminar about a month ago, and it was an extensive 4-hour seminar. Since then, I've divided that 4-hour seminar into about an hour-long segment. And this will be the last segment, segment 10, 11, 12, and 13. So today is a segment 10, 11, 12, and 13 on diabetes. If you have not watched segment 1 to 9, please go ahead and watch it. This will be on YouTube eventually, so you can watch this thing on YouTube. Share with your family and friends. If you have type 2 diabetes, this is a must seminar to watch. Particularly people in India, where type 2 diabetes is becoming rampant. All people in India must watch this type 2 diabetes seminar. So let's start with this type 2 diabetes seminar. So again, this is segment number 10. From segment 1 to 9, we have covered why type 2 diabetes happens, what are the causes, reasons for type 2 diabetes happening, the underlying physiologic or pathologic mechanism why type 2 diabetes happens. We briefly covered type 1 diabetes, type 1.5 diabetes. We also started covering the role of medications, role of diet, how we can reverse the type 2 diabetes. So please watch segment 1 to 9. Let's go to segment 10 now. The segment 10 starts with assessing your risk, whether you have a risk for developing type 2 diabetes or not. So let's quickly take this test. You can read on the screen, like how old are you? So answer that question, and then answer your question for the gender, whether you are a man or a woman. And then if you are a woman, did you have a gestational diabetes? And go ahead and give your points. And then do you have any family history of diabetes? And have you been ever diagnosed with high blood pressure? Go ahead and give your points. And then are you physically active? That means 150 minutes of physical activity per week, 150 minutes of physical activity per week. And then let's go to the weight category. This will be on the screen. I'll let it stay there for a few seconds so you can put your weight. So select either 1 point, 2 point, or 3 point based on your height and weight. You can freeze and look it up based on your height and weight. And let's give a total score. If you score 5 or higher, you are at risk of developing prediabetes and type 2 diabetes. Particularly if you are African American, Hispanic or Latino, American Indian, Asian American like Indian American like myself, or Pacific Islander, you are at even higher risk of developing type 2 diabetes. So I hope you took the quiz. If you did not take the quiz, you can take a later on the quiz. There are other online programs available to assess the risk for developing diabetes or prediabetes. So please assess your own risk as soon as you can. So again, when we talk about diabetes, It's important that we track certain things. We track blood sugar, for example. We track many of the labs. We track certain physical exams, certain doctor's visit. So let's see what you should be tracking if you have type 2 diabetes or for that sake, any diabetes. And track this thing either on a phone, on a note function, or have just a book or a binder where you can write down all this data. So what you should be tracking. Let's go through one after other. So if you have diabetes, particularly if you have type 2 diabetes, you should be tracking your weight every day. People who track weight every day have higher chance of losing weight and higher chance of maintaining ideal body weight. Track your fasting blood sugar every day. Check your post-meal blood sugar every day. Track your steps every day so you know how much physically active you are. Write down your activities if you're doing any weight training or any stretches. Track your sleep. Sleeping 7 hours or longer definitely helps to increase the insulin sensitivity, and that helps to bring the blood sugar down. So track your sleep. I strongly advise everybody having some kind of a tracking device. I have a Fitbit, which I love it. So consider buying a Fitbit. Now you can get a Fitbit only for $69. Definitely track your caloric intake if you are into it. I sincerely think that if you're eating whole food, plant-based, no oil diet, you truly don't need to track the calories, but some people are into tracking calories, so it's a fair call to track the calories. I have a separate video on YouTube whether you should be tracking calorie or you should be weighing on food. So please watch that video. American Diabetic Association also recommends tracking how many grams of carb you eat. And I've explained in my previous 9 segments. So what that YouTube video that we should be eating about 300 to 400 grams of whole food plant-based carb diet, which is, in my opinion, opposite of keto diet, where they, matter of fact, recommend less than 20 grams of carbohydrate per day. So in my opinion, the best diet is high complex carb diet, whole food, plant-based, no oil diet. And I have covered what a macro ratio should be extensively in first 1 to 9 segments. So please watch those 1 to 9 segments. Definitely track your blood pressure every day. Every diabetic should own a blood pressure machine and track the blood pressure every day. A lot of complications happen for people with diabetes because of the blood pressure, not because of the sugar. Also consider buying a continuous glucose monitor. If you have type 2 diabetes or type 1 diabetes, and if you're on insulin, then I think insurance covers the continuous glucose monitor. Otherwise, it's worth buying it. It costs about $70 a month if you want to do it and if your insurance doesn't cover. I have done it for myself, and it's very, very beneficial, very useful. Definitely weekly measure your waist diameter to see if you are losing any visceral fat, any abdominal fat. Monthly, average out your monthly steps. Fitbit can do it. Definitely track your average monthly sleep and consider having a body fat measure. Many stores can do it. Many fitness club can do it. You can actually buy Amran machine, which can do it also. So measure your body fat at least once a month, because when you're trying to lose weight, you don't want to lose muscle. You want to truly lose the body fat. So body fat percent going down will be better parameter whether you're using the weight right way or whether you're losing muscle or not. Uh, at 3 months, track your A1C, which is the 90-day average of blood sugar. Every 3 months, consider having a primary care visit or a doctor visit. And at that time, you should have a detailed food exam, because all diabetics are at risk of developing neuropathy and vascular disease. That means blood vessels in the leg could be blocked. And if that's the case, any injury in the foot can become a major issue. So definitely have a detailed neurologic food exam. At 6 months, check your cholesterol, check urine microalbumin, which is the protein in the urine. People with diabetes who spill a protein in the urine have a higher chance of kidney failure. Definitely check your kidney function, which we can check it with a simple blood draw we call creatinine. Definitely check your liver function, because people with type 2 diabetes, pre-diabetes, and insulin resistance are at risk of developing fatty liver and at risk of developing cirrhosis. So definitely check the liver function and have a dental exam. People with type 2 diabetes and insulin resistance have high chance of gum disease, and that can lead to chronic inflammation and many other these chronic diseases. So definitely a dental exam. Yearly eye exam, screen for heart disease. Consider getting an EKG, because many people with older age are at risk of developing atrial fibrillation, and atrial fibrillation can be silent without any symptoms. So doing an EKG is a fair call on a once a year. Definitely have a flu vaccine every year. Consider doing liver ultrasound, other tests to check for the fatty liver. and then every 5 years have pneumonia vaccine. Obviously, you should stay in touch with your primary care physician or your endocrinologist to see what else you need on a regular basis. But definitely tracking all this thing is very important. So let's briefly cover what is 24-hour continuous glucose monitoring. You have a blood sugar check every 15 minutes or even more often. It gives you daily, weekly, and monthly graphs. It costs about $70 per month. I've done it myself. My experience was very eye-opening. When I ate certain food, my sugar spiked up. For example, I ate pawa, which is a flat rice, processed rice, and my sugar shoot up to almost 180, 190. And when I ate certain other food, my sugar remained below 100, below 120. So again, doing a continuous glucose monitor gives you a quick reflex, quick answer to what kind of food you should be avoiding. If you are on insulin, insurance covers it. I definitely recommend to do it for 1 month for all diabetic. It will cost about $70, and I think it's worth that cost because you will get idea of every food, how it raises your blood sugar. So again, continuous glucose monitoring. Now, so how to handle hypoglycemia? People with diabetes, particularly type 2 diabetes, and if they are on certain kind of drugs, including insulin, they are at risk of developing low blood sugar and hypoglycemia. And for that reason, we have set the A1C goal of 7, so low sugar does not happen often. Again, I've explained in my segment 1 to 9 that A1C goal should be much lower if you are off any medication which can cause hypoglycemia or low sugar. But we should know when the hypoglycemia happens. Best thing is to prevent it. When hypoglycemia happens, person will start having racing heartbeats, sweating, jittery feeling, and that person can even lose consciousness. It's a very, very concerning, very alarming, very dangerous situation to get into. So best thing is to prevent hypoglycemia. If you feel like you are having hypoglycemia, take immediate sugar pack, candies with sugar or orange juice, and bring your sugar up. Do not skip meals if you're on insulin or certain medications. If you are doing a fasting, which I sometimes recommend, make sure you check your sugar often so to know the sugars are not going down. You may have to cut your medications or insulin if you're doing fasting or if you're not eating any regular meals. Um, uh, if you are following our program, you definitely will be at risk of developing hypoglycemia if you stay on the same medications because your insulin sensitivity will start improving. You will start bringing your sugar down. And if you don't cut your medication, you will be at risk of hypoglycemia. So if you are following our program, make sure you're cutting down your medications. Obviously, stay in touch with your doctor. If you're going through hypoglycemic reactions, definitely check your sugar more often. Stay in touch with your doctor. And it's proven that people who drink excess alcohol, they're at risk of developing more chance of hypoglycemia. So avoid any kind of alcohol if you are going through hypoglycemic episodes. Uh, let's cover how, if a person is sick, how to handle diabetic medications. If a person is sick, either with a flu or with a pneumonia or with a bronchitis or any other illness, diarrhea or stomach pains, any other illness, definitely check sugar often. If you're not able to eat regular meals, call your doctor and see if any medication needs to be lowered. If you have any infection, bacterial or viral, definitely seek medical care immediately and check your sugar often. Sugar can go off when you have infection because infection is stress on the body. Definitely rest more often than many non-diabetic people. People who are diabetic, when they get sick, they definitely need more rest and continue eating healthy, whole food, plant-based meals as much as possible. So my next question is, once a person has diabetes, what are the goals we set, and are diabetics getting to their goals? Because if you set the goals, if you are not getting to the goal, then what is worth setting the goals? So let's see how our country, how America is doing in terms of setting the goals and achieving the goals. Uh, First is getting yearly influenza vaccine. Only about 50% get it, which is unfortunate because everybody should be getting influenza vaccine. Getting pneumonia vaccine, only 50% get it. Food exam, in my opinion, should be every 3 to 6 months, and even a yearly food exam, but only 68% get it. Yearly eye exam, only 62% get it. A1C testing, only 70% get it. And average A1C of 7.2, less than 10 or 15% get it. So again, we are not achieving our goals. We are not getting the the proper care. Many of us have insurance, many of us have good doctors, but still somehow we don't achieve the goals. So in my opinion, if you have diabetes, particularly type 2 diabetes, make sure you stay on top of your goals. Ask your doctor, how can I achieve 100% on all my goals? This is another graph. Again, A1C achieving 7 is about 50%. Achieving less than 8 is about 80%. So a lot of people stay between 7 and 8. Getting the blood pressure goal below 130/80 is about 50%. Getting LDL, the bad cholesterol goal, below 100 is about 50%. And being on statin, which is a cholesterol lowering medication, is about 50%. And having all three goals, A1C below 7, blood pressure below 130/80, and LDL below 100 is only about 10 to 15%. So achieving all the goals in diabetic is relatively uncommon. Only less than 15% achieve all the goals. So I want all of you to be the person who achieve all the goals in type 2 diabetes. And again, all those goals are described in my other segments. Please watch segment 1 to 9. But the key goals are A1C below 7, blood pressure below 130/80, and LDL below 100. I want all of you to achieve all three goals. Stay in touch with your doctor to see how you can achieve all three goals. If you achieve all three goals, it will prevent many complications, which we'll cover as we go in this talk. Let's talk about diabetes and microbiome. This is a kind of a hard topic for last few years. A lot of people are trying to understand what the microbiome means. So as a human, we have actually more cells in the body which are foreign cells. We have 39 trillion bacteria in our body, 30 trillion human cells. And this bacteria resides on different areas of the body, including our intestine, mostly colon, our skin, our nasal cavity, oral cavity, many areas of the body where this bacteria reside. But again, we have more bacterial cells than human cells. We have more bacterial genetic material than a human genetic material. And this bacteria, particularly the one in the colon, is considered one of the very important microbiome. So the bacteria in the colon depends upon what we eat. We'll talk in a second. How much we sleep, how much exercise we do, what kind of pets we have, our family members, our connection to the nature, and many other factors affect our microbiome in the colon. Definitely, role of fiber is most important. When we eat a whole food plant-based diet with lots of fiber, particularly lots of soluble fiber, the bacteria in the colon thrive on this soluble fiber. Soluble fiber actually is the food for the bacteria in the colon. And that bacteria actually grow, particularly the good type of bacteria grow, and our microbiome improve. Now we'll talk about what the role of bacteria is when it digests the soluble fiber in a second. You can get actually your microbiome analyzed by American Gut Project only for $89. I typically don't recommend doing that because if you eat whole food, plant-based diet without any oil, automatically your microbiome will improve. You don't need to get the test done. But if you are really curious how your microbiome is right now, you can get it done for $89. So again, bacteria in the colon makes a small chain fatty acid from the soluble fiber. Remember this word, SCFA, small chain fatty acid from the soluble fiber. This small chain fatty acid has many beneficial effects, including improving insulin sensitivity. 90% of Americans actually eat less than 30 grams of fiber. The recommended amount of fiber is 30 grams per day. Many of my patients and many Americans actually get less than 10 grams, and some of them even get less than 5 grams of fiber per day. And that's because most of our diet, most of Americans' diet includes animal products. And animal products have zero fiber. Red meat, chicken, fish, turkey, dairy, cheese, all of them have zero fiber. So if you want to increase your fiber intake, increase the whole food plant-based food. I have recorded a separate video on fiber for about 30 minutes. Very important subject to understand. Please watch that video on fiber. It's already on YouTube channel. But again, fiber is one of the most important nutrient. Matter of fact, fiber is one of the few nutrients where it's shown that every time you eat more fiber, you live longer. So again, fiber is very important. Microbiome also can control the appetite. We also know that certain kind of harmful bacteria can turn red meat choline into TMA, and then TMA turns into TMAO in the liver, which is very harmful, cause many issues, including heart attack and heart disease. So again, preventing harmful bacteria growing in our colon, and not eating a lot of red meat will prevent a lot of chronic disease, including heart disease. Um, so if you want to start improving your fiber intake, start small amount of fiber and start slow. That means eating one meal, whole food, plant-based, no oil, and then getting increasing gradually by second meal and third meal, and eventually you'll be on whole food, plant-based diet. Obviously, I don't want all of you to go vegan, but at the same time, minimize the animal product. My recommendation is about 10% of your calories should come from animal products. So again, 10% of your calories should come from animal products. That means either very small amount of meat uh, or a small amount of dairy product. Uh, uh, Most blue zone people, which will cover people live long and healthy, have about 10% calorie, 5 to 10% calorie from animal products. So again, this slide shows the importance of dietary fiber and gut microbiome. So when we eat soluble fiber, the gut microbiome produces small chain fatty acid. This small chain fatty acid improves the gut mobility, it improves the satiety, it improves the insulin sensitivity, and that leads to many benefits, including lowering of risk of type 2 diabetes and improving the sugar control in diabetes. When this small chain fatty acid happens, it lowers the adiposity, it lowers the fat cells, it increases the leptin secretion, which is an important hormone for satiety. It also improves the insulin secretion. It also increases norepinephrine, which increases energy consumption and your basic metabolic rate. And it also improves the intestinal sugar metabolism. It also can lower your blood pressure. So there are tremendous benefits of small chain fatty acid which are made from the soluble fiber by the action of gut microbiome. So I want you to understand everything about microbiome. Let's cover a next topic, which is an important topic, the why Indians like myself and Indian Americans develop high chance of type 2 diabetes. In India, type 2 diabetes now is about 12 to 14% in urban population and 8% in rural population. Some cities in South, the prevalence of type 2 diabetes is almost 20%. And some of those cities actually after age 50, type 2 diabetes is almost 50 to 70%. So almost 1 in 2% after age 50 has type 2 diabetes. And that has led to many unfortunate young age deaths, young age heart attack, young age blindness, young age dialysis. And India is actually becoming the diabetic capital of the world, diabetic capital of the world. That needs to change, and we'll work together to change. Some of the mechanisms which have been explained are low pancreatic beta islet cells, which secretes the insulin, and having a lower efficiency or lower function of those cells. So we have less insulin secretion from the beta islet cells. So this is one theory. We also have a low muscle mass for the same body mass index. So Indians typically have less lean mass for the same weight. They have higher body fat percent, which we have discussed in other segment 1 to 9, which leads to insulin resistance. We have more visceral fat. You've seen many Indians, all of us, including myself, we all have a little bit bigger belly compared to what our weight is compared to Americans. So we definitely have more visceral fat. We definitely eat a lot more processed food and dairy. In India, people take a pride being vegetarian, but a lot of this vegetarian is very unhealthy processed vegetarian. We'll cover that in a second. And we still continue to eat a lot of dairy. In my opinion, they both have led to significant rise into type 2 diabetes. We are definitely less physical active in an urban area. Everybody rides on the scooter or a bike. Everybody takes their car. Everybody takes the elevator. And we need to be more physically active in both urban and rural area. Matter of fact, it's been shown that when a carb load is given to an Indian, they secrete much less insulin compared to the same load given to an American. So we definitely have less efficient beta islet cells in the pancreas. Many times insulin does not spike above 50, while I've seen some of my patients, white patients, black patients, where their insulin is above 100 after a carbohydrate load. So again, we definitely have inefficient insulin secretion. This is something what we eat. Sometimes we take a pride that we are vegetarian, but obviously this is as bad as red meat or any other meat or cheese. This is actually worse than cheese. Again, you can see clearly the sugar, the fried part, the dairy, and everything else is ready to cause the type 2 diabetes. Again, this is probably some kind of chicken dish with tons of gravy, tons of oily and dairy stuff. And again, we eat a lot of white naan and white bread. This is all processed grain, and this is the reason people in India and even Indian Americans develop more type 2 diabetes. So this was a conclusion of segment 10. We will quickly go to segment 11. So let's start with segment 11. Again, if you have not watched segment 1 to 9, please watch them. Um, uh, to, uh, to, to give you the good news, we are 21,000 followers on our Facebook. Our movement is growing rapidly. Thanks to all of you for inviting your friends and family to our page. We are already on YouTube. We have significant number of subscribers now. We have about 85 or 90 videos on YouTube, so please watch them. We are also on Instagram. We have about 3,000 Instagram followers. Again, thanks to Hannah, our social media director. Thanks to my family, my wife, kids, and all the mentors where I've been learning. All the patients where I'm learning most from by helping them to get healthier. Actually, I'm learning for myself and for all our followers. I want to cover the next topic is diabetes in the blue zone. Blue zone are the zones in the world where people live long, people live healthy, people live happy. Many of them are centenarians, many of them live up to 100. So what are the typical blue zones? There are 5 main blue zones described: Okinawa, Japan; Icaria, Greece; Loma Linda, California; Nicoya Peninsula in Costa Rica; and Sardinia, Italy. You should read about the blue zones from books, from YouTube videos. Dan Buettner coined the term. He's a National Geographic reporter, science reporter, and that concept is worth understanding, worth knowing. So this is one of the blue zone called Okinawa in Japan. And let's quickly go through this slide. This is a busy slide to see it on the screen, but let me read it to you. In Okinawa, Japan, their diet consists of 70% sweet potatoes, 70% sweet potatoes, 12% rice, white rice probably, 7% grain and wheat, whole intact grain, 6% soys and legumes, 4% additional vegetables, and 3% fruits. So their diet is predominantly whole food plant-based diet, whole food plant-based diet, and with minimum or no oil. Minimum or no oil. There are minimum or no animal products on everyday base. They have less than 1% of pork, less than 1% of eggs, and less than 1% dairy, and less than 1% fish. So again, Okinawan people, they don't eat fish every meal. Fish in their diet is probably a few times a week, very, very small amount, compared to Americans where animal product is with every meal in a large amount. Most American plate plant-based food is the smallest portion. It's mostly the animal-based food, animal-based product, which is the largest portion. That need to change. We are living much less. We are actually living 24th in the world in terms of longevity. We spend highest amount of money per person in America, but we are 24th in the world in terms of our longevity. So that needs to change. So people said that Okinawa obviously is an exception. That's not true. We have people in America who live like Okinawan people. So those people are the Seventh-day Adventist people. The large segment lives in Loma Linda, California. And this Seventh-day Adventist people live right in our backyard. Even in my own town, there are Seventh-day Adventist people. And these people typically consume large amount of fruits, vegetables, and whole grain. They're very low amount of low-fat dairy, legumes, and nuts, and they definitely use very less saturated fat, cholesterol, sugar, and salt, very less amount, almost none. And they definitely abstain from meat, tobacco, alcohol, and caffeine. So they don't eat any meat, they're vegan, they don't smoke, they don't drink alcohol, and they don't even have caffeine. And these people, Seventh-day Adventist people in Loma Linda, live 10 years longer than an average American. They reserve the Saturday for a day of rest and worship. They spend a lot of time in the community. They move every hour, and they focus on God, family, and community. And these are the people we can emulate. These are the people we can follow. These are the people we can definitely role model. So let's see what the diabetes prevalence is in these people. Again, this is Loma Linda, California. Most of their diet includes vegetables, fruits, legumes, and soy. They are very minimum dairy, very minimum meal. And actually, Seven-day Adventist vegan people have no dairy and no meat. So this is the incidence of obesity and diabetes in Seven-day Adventist people. This is from the Adventist Health Study 2. People who are Seven-day Adventists and are vegan, their body mass index is only 23. And if they are non-vegetarian, if they are meat eaters, is 28. So you can immediately see the major difference between vegan 7-day Adventists and non-vegetarian 7-day Adventists. Almost a difference of 5 BMI. Very concerning, very risky. And if you look at the type 2 diabetes in vegan 7-day Adventists, type 2 diabetes only 2.9%. One of the impressive number. Only 2.9% in 7-day Adventist vegan people. And in non-vegetarian 7-day Adventist people, it's 7.6%, almost 3 times, 4 times higher than vegan people. This is the Blue Zone food guideline, which I'll quickly read it to you. It's a little bit hard to read on the screen on the phone. So 90 to 95%, 95 to 100% plant-based. Again, Blue Zone food guideline, 95 to 100% plant-based. Go with a whole food plant-based diet. Daily dose of beans or legumes. Drink mostly water. Or green tea. A snack on nuts, but a very small amount of nuts. Definitely go easy on fish, once or twice a week, very small amount. Eliminate the eggs or no more than 1 to 2 eggs per week. Definitely no sugar, reduce dairy or no dairy, and definitely have minimum amount of meat or no meat. These are the food guidelines from Blue Zone. These are available online on Google. Please look it up. If you want to live long, if you want to live healthy, if you want to live happy, Blue Zone diet is the diet to follow. Blue Zone lifestyle is the one to follow. Let's look at the next topic. This is a major important topic, diabetes complications. People with diabetes don't die because of the sugar. They die from heart disease, heart attack, stroke, kidney failure, dialysis, and cancer. So again, controlling sugar is important, but controlling complications is very important. Now, I have explained to you in my previous segments that there are 3 goals, three targets in diabetes, particularly type 2 diabetes. Number 1 goal is reversing insulin resistance. Number 1 goal is reversing insulin resistance. Second goal is controlling sugar and A1C. And the third goal is preventing complication and maintaining the lifespan. Like I said, every diabetic person lives 10 years less than a non-diabetic patient, 10 years less. So if we prevent the complications, if we do the right thing, we can make all type 2 diabetic live as long as the non-diabetic. And the best way to do is to reverse the type 2 diabetes. I've given tools how to reverse type 2 diabetes in my previous segment. Please watch all those segments, segment 1 to 9. Like I said, diabetic lives about 10 years less than non-diabetic. So what are the complications? Number 1 is heart, which is heart blockage or coronary artery disease, heart attack, heart failure, and atrial fibrillation, which is irregular heartbeat. Brain complications include stroke, Alzheimer's disease, dementia, memory loss, Parkinson's disease. Some of the leg complications include vascular disease or leg artery blockage, ulcers on the leg, and neuropathy. Some of the gum complications include inflammation, infection, and teeth loss. People with insulin resistance, they are actually risk of developing heart failure even before the diagnosis of diabetes happens. There are many studies done. Even when the A1C was only 5.7, 5.8, they had a high risk of developing heart failure. The next set of complications include nerve or neuropathy complications, Charcot joints, erectile dysfunction in men, skin changes, cancer. Diabetic patients are very high risk of developing certain cancers, and definitely autonomic dysfunction where you lose your autonomic function. Eye complications include retinopathy and blindness. Kidney complications include kidney failure, dialysis. Liver complications include fatty liver and cirrhosis. Matter of fact, now fatty liver and cirrhosis from fatty liver is the #1 reason for liver transplant. That needs to be prevented. A lot of cancers are common in diabetes, particularly type 2 diabetes. Those are breast cancer, liver cancer, colon cancer, uterine cancer, and many more cancers. A lot of infections are very common in type 2 diabetes. Gout, which is arthritis in the joints, which is also very common, and certain skin issues. So again, complications of diabetes are put into microvascular and macrovascular complications. You don't have to definitely understand these terms itself, but microvascular complications are complications on an eye, kidneys, and neuropathy. And macro, which are the large vessel complications, are brain complications like strokes, heart complications like heart attack, and peripheral arterial disease. Let's talk about neuropathy. Neuropathy happens because of damage to the nerve endings, loss of sensations, particularly in the feet, and they are very high risk of injury, infection, and foot ulcer because they don't feel when they step on a sharp object. They are very high risk of amputations. So for that reason, I always advise all diabetics to get a proper foot exam every time you see your primary care physician. Definitely wear proper diabetic shoes, which is must in all diabetics. This is the simple ulcer. You can see it's an infected ulcer, and that ulcer can eventually can lead to complications, including foot amputation. And you can imagine what life would be if you lose your leg, or if you lose your feet. So very, very high complication rate. We should be all preventing this kind of complications. Kidney complications includes lowering of kidney function and going on dialysis. Ask your primary care physician every time you see him or her that what is my kidney function if you are type 2 diabetes. Definitely prevent the dialysis by all means. Eat plant-based diet with a plant protein, no more than 70 to 80 grams per day. We typically eat a lot more protein than what is recommended. So again, never listen to your personal trainer, or don't listen to anybody online or on Google, on YouTube, that you need to eat more protein. We need to eat probably 60 to 70 gram protein maximum 80 gram if you're an athlete or if you're a bodybuilder. And in female, it's about 50 to 65 grams. So again, we eat a lot more protein than what is recommended. Protein actually is the reason longevity can go down. People who eat 100 gram, 150 gram, 200 gram of protein live less. So don't eat definitely too much protein, and have as much plant protein as possible. Again, you can clearly see the person getting dialysis. Make sure we prevent all this complication as much as possible. Diabetes and stroke is also very common, 1.5 times risk of developing stroke if you have diabetes. You can clearly see the person on the screen that that person has developed a stroke. Alzheimer's disease is also very common in people with type 2 diabetes. Matter of fact, Alzheimer's disease is called type 3 diabetes, and brain neurons develop insulin resistance. Autonomic dysfunction also can happen in diabetes, where you have episodes of low blood pressure with standing. They also have some bowel movement disorders, Parkinson's disease, abnormal heart rate, abnormal heart function. So again, if you have autonomic dysfunction, make sure you talk to your doctor. Make sure you see a specialist if necessary. Diabetes can also lead to gastroparesis, which is essentially a stomach not emptying very efficiently, and stomach emptying is delayed. And there are a lot of symptoms, including nausea, vomiting, and poor digestion. So if you have gastroparesis, make sure you talk to your doctor, see a stomach doctor if necessary. Diabetes and heart failure also is very common. Like I said, people with insulin resistance, even before the diagnosis of diabetes, both systolic and diastolic heart failure can happen. People who develop atrial fibrillation, which is irregular heartbeat, are at high risk of embolic stroke. That means a small blood clot going from the heart to the brain if they have diabetes. So again, if you have atrial fibrillation, make sure that your doctor knows whether you have diabetes or not. So again, let's quickly reflect on what we have covered. Just read along with me that you have any complications of diabetes, what I listed. And how can you prevent complications, and how can you reverse complications? And my next question to you is, how many of you know about blue zone, read about blue zone, and would you read more about blue zones? In my opinion, reading about blue zone is one of the most important things you can do for yourself, how to emulate, how to mimic the lifestyle of the people who live long, live happy, and live healthy. Let's go to segment 12. Again, we are live on Facebook. Please share with your page so other people can be on live. Please share our live segment to your page so other people can watch it. Please invite your friends and family to our Facebook page. Please subscribe to our YouTube channel. Like I said, we have crossed 20,000 mark, 21,000 matter of fact, as our followers. We are growing rapidly. We bring every day 5 or 6 times different type of information, including different posts with graphics, different lives, Facebook Live, different guests coming on, different cooking demonstration. So we are definitely, learning together, growing together, keeping healthy together, and happy together. Let's quickly cover COVID-19, which is obviously a current crisis, and diabetes. So if a person has COVID-19 condition, then if they have if that person unfortunately dies, there are very high chance that that person probably had diabetes, high blood pressure, or heart disease. So uh, people who have chronic conditions, obesity, diabetes, high blood pressure, heart disease, if they develop corona infection, they have very high chance of dying. Right now, the current death rate or mortality rate or death rate with corona infection is about 0.5%, 0.5%. But if a person has obesity, means BMI about 30, if person is 70-year-old, person has diabetes, high blood pressure, and heart disease, that person has a mortality or chance of dying almost 25 to 30% if they develop corona infection. The reason I want to show this slide is because if you have diabetes, if you have high blood pressure, if you have heart disease, if you are elderly person, by all means, prevent getting corona infection. Very important to prevent corona infection because that person will have very high chance of dying if they acquire corona infection. Fortunately, a lot of young people who don't have any of these chronic conditions, they survive the corona infection because their immunity is very high. They don't have any chronic disease. I've seen many young patients whose body mass index is above 40. They're very obese. They're very, very obese. They have very high chance of dying if they develop COVID-19. These are the death rate if a person develops COVID-19. If a person has heart disease, 10% chance of dying, very high. If a person has diabetes, 7% chance. If a person has a COPD or lung disease, if a person has a high blood pressure, if a person has a cancer. And if a person has no chronic disease, death rate is very low, like I said, 0.5 to 1%. If a person has a multiple conditions, the death rate with COVID-19 can be as 25 to 30%. So very, very high risk of dying if you have many chronic disease, if you are elderly, and if you are obese. So what can you do if you have diabetes and if you need to take precautions? Obviously, continue taking your regular medications, continue glucose monitoring. If you have type 1 diabetes, ketone level monitoring is also very important. Continue eating healthy. That means eating whole food, plant-based, no oil diet. Have a minimal animal products. Continue your physical activity, mostly outdoor, not going to the gym right now. Avoid smoking and definitely have stress management. Uh, you also should be getting your vaccinations because right now COVID-19 is very, very prevalent, obviously, but soon in September, October, flu season will start. New bacterial pneumonia will also start coming in. So you should be getting your flu vaccine and pneumococcal vaccine. Hopefully we will have a corona vaccine soon in 6 to 12 months. But before that, we need to be very, very careful, particularly if you have a lot of chronic disease and particularly if you have type 2 diabetes. So let's see what kind of diabetic team you should assemble to take care of type 2 diabetes. Type 2 diabetes is a multi-system disease. It involves the whole body. It involves the whole body. For that reason, we need a lot of members in a diabetes team. Number one member, the most important member will be your primary care physician. No. You also need your family members as a team members for diabetes. You need sometimes a diabetes doctor, endocrinologist. We are bringing an endocrinologist tomorrow live. So please stay tuned for tomorrow. We'll be posting how you can watch it. It's tomorrow at 1 o'clock. Other team members should include dentists. Like I said, gum disease is very common. Podiatrist, a foot doctor, because neuropathy in the feet is very important. Vascular disease is very important. Consider having an exercise physiologist or a personal trainer. Definitely an eye doctor for yearly eye exam. A psychologist, because people with diabetes have very high chance of developing depression. So definitely consider psychologist. Like I said, endocrinologist or a diabetes doctor, a pharmacist to explain you all the medications and interaction of all the medications, social worker to make sure that you're getting proper insurance and proper supply. Definitely, if you are from a certain population, then having an Aboriginal healthcare worker, definitely a dietitian. Dietitian is very important. We have brought various dietitians on our Facebook Live. We just had a Mosmi. She gave a great talk on how you can reverse the diabetes and what you should be eating if you have diabetes. Definitely having a nurse to learn maximum everything about type 2 diabetes. Definitely having a diabetic nurse practitioner to make sure your primary care physician get adequate hours to see you if you're type 2 diabetes. So again, And having a cardiologist also, in my opinion, is very important because most mortality, most death in diabetic happens because of heart disease. So consider also having a cardiologist in your team. So again, you should be assembling a team if you have type 2 diabetes or if you have any diabetes. So I want to quickly give you some resources if you have diabetes. The greatest resource is called Mastering Diabetes. They are on Google, they are on YouTube. They also have a book. This is by Cyrus Kambata. Uh, Great book, Mastering Diabetes, a must book if you have type 2 diabetes. Neil Barnard, one of the great author, also has a books on diabetes, and he also has many YouTube videos. Joe Furman, one of my favorite author, also has a book. His book, It to Live, I highly recommend. In my opinion, everybody should own It to Live book, and he has a lot of YouTube videos. Brenda Davis, a great nutritionist, great dietitian, has diabetes. Has a book called Kick the Diabetes, one of the great book if you are type 2 diabetes. She also has a lot of YouTube videos. Michael Greger, another giant, also has some great videos. He also has a book called How Not to Die. Definitely reach out to American Diabetic Association website. They also have some great resources. I also like to give you some names. There is right now a big movement going on, a keto movement to reverse the diabetes, lower the A1C, lower the sugar. I'm not in that camp, but I want you to be your own judge. Make your own decision. Read about the keto movement. Read about what keto can lead to in terms of a reversal of diabetes. In my opinion, I have explained to you in segment 1 to 9 why keto diet is not the diet I would want you to follow, and giving you the mechanism, giving you the reasons for it. So please watch those segments. But definitely, if you are interested in keto diet, look up Stephen Feeney. He has some great YouTube video. He also has a book. I own his books too. I've read everything about it. There's another PhD, Benjamin Bickman. Jason Fung is very popular. He has some videos which have watched, which have been viewed millions of times. He has two books, Diabetes Code and Obesity Code. Sarah Holberg has a great videos on YouTube. Eric Westman is also very popular internist, a proponent of Atkins diet and keto diet. So you can read about all this thing from all these authors. You make your own decision, make your own judgment. I'm definitely not into the keto camp. I'm more into whole food, plant-based, no oil, complex carb camp. My macro recommendation, macro in the diet recommendation is about 75% of all complex carb, whole food, plant-based, about 10 to 15% of fat, and only about 10% of protein. I have covered keto diet and paleo diet in my previous segments. Please watch those segments. Those are segment 1 to 9. There's a company called Vertra company, which is becoming lately very popular. They actually promote low carb living. They charge about $249 a month. Just check them out. Again, I want all of you to be your own judge, but I highly say keto diet is not the diet if you're type 2 diabetes. I also have John McDougall, one of the great author. He is a more of an intact grain-based author. He also has a 10 days living cap in his California practice. So if you are serious about reversing type 2 diabetes, consider living 10 days with his camp. True North is another living cap. True North is very popular if you are planning to do any long-term fasting. They have a residential facility where you fast for 3 days, 1 week, even up to 3 weeks. You can fast and they will monitor you. Predican centers are also very popular. Predican Center is one of the oldest lifestyle center, and you should read about Predican, Nathan Predican. He has some great YouTube videos. I think, in my opinion, I will consider him the father of healthy lifestyle, because he was not a physician, but he has started this healthy lifestyle movement. Actually, many of the whole food plant-based reversal of heart disease programs, including Dil Ornish program, are based on Predican program, Predican center. I think he has a center in California, and I think he also has a center in Florida. Definitely, Joe Furman. I repeat myself, Joe Furman is one of the most important person to follow. There's another author, Gabriel Cousins. He has some great videos on YouTube also. So what documentaries to watch? Folks Over Nice is a must for everyone who wants to stay healthy. Fat, Sick, and Nearly Dead. What the Health? The Magic Pill. The Game Changer. If you are into sports and fitness, Game Changer is one of the must documentary. How you can be vegan and can be very fit. Food included. Super Size Me, Food Fight, Hungry for Change, Killer at Large, Kids Menu, Fed Up, The Sugar Film. a touch of sugar, undiagnosed, which is a popular show on PBS, blood sugar rising on PBS, simply raw. So again, some of these things are great documentaries. You should watch them, just Google them, just YouTube them, and you should be able to watch it free. Many of them are already on Netflix. So let's cover the last segment, segment 13, how to how to start reversal of type 2 diabetes at home. This program, in my opinion, would cost you thousands of dollars, but I'm going to show you how you can do it, the reversal of type 2 diabetes at home with your physician supervision. Your own physician can supervise you while you reverse type 2 diabetes. I have many patients now who are into the reversal process. Matter of fact, I have one patient right now. She has lost about 23 pounds in 21 days. She has fasted a few times. Her insulin used to be 200 units just 3 weeks ago. Now she's only about 45, 50 units per day. So one of the greatest reversal in just 3 to 4 weeks. And like Dr. Furman says, that if you are type 2 diabetes and if you follow his diet, his page 216 from It to Live book, you can reverse the diabetes in 1 to 3 months. You can be off insulin in 1 month or less. So again, if you want to reverse type 2 diabetes, let's follow next few slides. So number one, you should know why you want to reverse type 2 diabetes. Unless you have the purpose, unless you have a reason for it, you will not be able to succeed. Just like anything else in life, we have to purpose for it. So your purpose could be that you want to live long. Maybe you want to see your grandkids' graduation. Maybe you want to see your grandkids' wedding. Maybe you want to avoid suffering. Maybe you want to visit Paris, or you want to visit wherever when this COVID-19 crisis is over. Maybe you want to learn a new skill. Maybe you want to spend more time with the spouse and the family. So definitely have a purpose before even you start the reversal of type 2 diabetes. Watch our segments, segment 1 to 13, at least 3 times. I have packed everything you need to know about type 2 diabetes in 4 hours. I read and studied and watched videos for 100 hours, and I have packed those 100 hours of my learning into 4 hours. So if you want to reverse type 2 diabetes, watching this all 13 segments at least 3 times is must. It will take you 12 hours. Do it at a piecemeal way. Do it at your own convenience, but watch it at least 3 times. Number one, clean out your pantry and refrigerator. I've shown you in my previous segment how you can clean out your pantry and refrigerator. Start with a breakfast, whole food, plant-based, no oil. Whole food, that means oatmeal, fruits, berries, or whatever vegetables you like. Add whole food, plant-based, no oil lunch in 1 week. So have breakfast and lunch both. And after 1 week, add a dinner and have all the meals whole food, plant-based, no oil. And I've shown that in my previous segments. Start with walking 20 minutes every day and increase to 1 hour by 1 month. If you are not able to walk, do a stationary bike, but minimum 1 hour activity within a month. Add weight training very slowly, either body weight or free weight, light weights, or machine-based weight training, but definitely add weight training. Sleep 7 to 8 hours, sleep 7 to 8 hours, because we know sleep improves insulin sensitivity. Have a 20 minutes of meditation, because many times there's a lot of emotional eating involved. So definitely do 20 minutes of meditation. Watch your blood sugar and blood pressure, because as you start following this program, your blood sugar and your blood pressure will start coming down, and you will need to cut the medication. So stay in touch with your doctor. My program, I can assure you, I can guarantee you, is going to work. If you follow 100% of what program I taught you in this 13 segments, not only you will reverse diabetes, you will get off all your expensive medications, including insulin. You need to lose only about 15% of weight to reverse the type 2 diabetes. I've shown you in my previous segments, you don't need to lose a lot of weight. So for example, if you are 200 pounds, you need to lose only about 30 pounds to reverse type 2 diabetes. If you are 300 pounds, you need to lose only about 45 pounds to reverse the type 2 diabetes. And that can be done in 6 to 12 months. Person who has 300 pounds can easily lose 2 pounds, 3 pounds per week. Like my friend, my patient is losing 7 pounds a week. So if you are 300 pounds, you can easily lose 3 pounds per week. And in 6 months, you can reverse your diabetes, type 2 diabetes completely. Drink water only as your beverage, and avoid alcohol, avoid any kind of soda or pop by all means. Definitely stay in touch with your doctor because your sugar will start coming down, your blood pressure will start coming down, and you will need to cut your medications. So again, this concludes all 13 segments. This was segment 10 to 13. I have recorded segment 1 to 9 in a separate YouTube videos. Please watch all of them. I really enjoyed giving this 13 segment. I will have update every 6 months. I'll re-record all 13 segments every 6 months to make sure the science is updated, knowledge is updated, and recommendations are updated. Again, we are on YouTube, so watch other videos. Invite your friends and family to like our Facebook page, like our Instagram, subscribe to our channel. Like I said, we have crossed 21,000 mark on our Facebook followers just in 6 months. Thanks to all of you. Uh, we are bringing various guests on our Facebook Live, and you are learning from those guests. I'm learning from those guests. We are showing live cooking demonstrations on whole food, plant-based, no oil cooking. My wife Jaishi has been very instrumental in doing that. So again, thank you for joining this movement. We will be growing. We'll be learning from each other. We'll be staying healthy. We'll be living long. Thank you. And if you have any questions, go ahead and ask me questions, and we'll answer all the questions. Again, join tomorrow for a Facebook Live with Dr. Gulati. She will be bringing on type 2 diabetes, how lifestyle can reverse it. She'll be also talking about hypothyroidism. She'll be also talking about polycystic ovarian disease. So definitely cannot miss tomorrow at 1 o'clock. Thank you.